I feel that the public should be informed and be able to make an informed decision. Now, the Dental Association, now I have I have articles that the Endodontic Society sent me back in about 1992. I said, I keep hearing about how safe root canals are, and I do a lot of root canals, or I used to do a lot of root canals, and I need some answers for this. And I'll be happy to pay for reprints that prove that root canals are safe. I said, you don't have to pay for it. We'll send them to you. And they sent me probably 100 articles. Well, I read them, and there wasn't one of them that proved that it was safe. There were a lot of articles that said root canals are 90% safe, 95% safe, 97%, that's where they are now, saying that they're 97% successful. But there is no definition of the word successful. Primarily, it means freedom of pain.
Give us a sense of what a root canal is. What is the essence of it? Explain it to the public.
That is a really good idea, Kim, because of all the people I've talked to about it, very few people in the public understand what a root canal is. I've had them say, well, can't you take the root canal out and leave the tooth in? Well, the tooth is the root canal tooth. The tooth is kind of like the old Dixon Ticonderoga pencil that we used in first grade. And the lead in the center represents the pulp chamber. So there is a nerve chamber in the center of the tooth. And what the dentist does is to drill a hole through the crown of the tooth, the part that's up in the mouth, and drill this hole down into the pulp chamber and then clean out the material that is in there. And they tell the patient they are sterilizing the tooth. Well, what Weston Price came up with recently, that is in 1909, is that there are about 75 auxiliary canals just in a front tooth. Well, there's no way you can get into those 75 canals. And then there are also dentin tubules. The root of the tooth is composed of lots and lots of little tiny pieces of spaghetti, is what it amounts to. And there, if you hooked all of them together, they'd be 3.5 miles long just in a front tooth. Well, there's no way you can get into that and clean it out, although they claim, well, we have some strong chemicals that'll penetrate all the way through. Well, there's no such thing. From the standpoint of physics, you can't do that. They say, well, we have laser and that kills everything. Well, it doesn't kill everything. But the real problem is, as the bacteria create their toxins and get an excess population, it goes to the outside of the tooth. The tooth has enamel, and under that is dentin, and inside that's this pulp chamber. But if you look down in the bone, you don't have enamel. You just have the dentin and the pulp chamber. Well, the tooth is not really directly attached to bone. There are fibers that come out of the tooth and fibers that come out of the bone, and they intertwine to form something called a periodontal ligament. That's a ligament that really attaches the tooth to the bone. Otherwise, you couldn't get the tooth out. Well, this is where the maximum concentration of those bacteria occur. And then, doing DNA analysis, we've worked with this the last 4 years, we found that the tooth has a certain amount of bacteria. If we crush the tooth, we've got a certain amount of bacteria. But if you scrape off the ligament, if you cut it off, it has even more bacteria and toxins in it. And then after about 3 years, it finally dawned on me, you don't suppose this goes into the bone, do you? I guess I'm a slow learner. But anyway, I followed up on that, and we started taking blood samples, and good grief. The blood samples around, you take the tooth out, let it bleed a little bit. The blood there is highly contaminated with these bacteria. In fact, this is another part, we were talking a little while ago about the treatment. This is another part that is extremely important. When you take the tooth out, just to be silly so that a dentist will remember this, I tell them, take the patient by the heels, hold them upside down, and shake them and make that socket bleed. Well, they may forget about making the socket bleed, but they always remember, take them by the heels. As soon as that tooth comes out, they get a mental image of picking the patient up. which means let it bleed, let it clean the bone around that tooth, because that is highly toxic, and that has not been sterilized by any means. So the tooth comes out, and take the suction, put it in there. You take a burr, you cut out the periodontal ligament in the bone. It's kind of a complex procedure, but so is landing a 747, but it doesn't take but a few seconds to get it on the ground. It only takes a few seconds to clean these sockets out properly. And then allow it, force it, make it bleed, and you don't need a transfusion. Hey, you're taking out maybe a teaspoonful of blood. But that's going to speed up the healing by 6 months minimum. So you let all of that come out because you've got all this bacteria. Well, the bacteria has been sitting there in the periodontal ligament, and every time you bite down, squirt, that goes into your blood system. And this is what I think people have a right to know, that anytime you're chewing gum, man, are you doing your body some real harm. Or if you eat food. Now, somebody's going to say, well, Huggins says don't ever eat. Well, either that or take the root canal tooth out. It's your choice. But when you bite down on these teeth, it squirts that bacteria out into the blood, which we have tested and found to be very rich. Hey, out there in the bone, you got a smorgasbord out there. I mean, not only you got great desserts with sugar in them, but you've got T-bone steak and coleslaw, and there's just everything in the world that bacteria could want to survive. But the bacteria and their toxins go into your bloodstream to every place in the body that blood goes, which is every place in the body.
Many dentists and people will also say who've been to dentists who told them this, the last thing you want to do is remove the tooth.
That's right.
Always try to save the tooth. Now, where did that come in? Is there any validity to that, and what do you say about that?
Well, if we go back 100 years, 150 years, so when they started placing amalgam, the story was you got a cavity, you can scrape the decay out and fill it with a combination of mercury and copper and silver and tin and zinc, and hang on to the tooth for another 5 or 10 years. Well, that's before it has reached the pulp chamber. And so, yes, it is better to have a tooth with a filling than to have the tooth removed, because they didn't have anesthetic back there, and taking out a tooth was traumatic. Take a tooth out without anesthetic, that's why they had 8 people holding you down while they did it. And it's better to fill a tooth, and then, of course, they found that maybe that's not exactly true because the mercury is poisonous and creates autoimmune diseases. Well, an autoimmune disease can happen from mercury or root canals, either one. And if you're saving the tooth, you're doing it at the expense of what?
Your whole body.
Yeah, you may have diabetes, you may have heart disease, you may have cancer, you may have Alzheimer's.
What do you recommend, Dr. Huggins, to fill the teeth when people have cavities then? What are you recommending?
All right, what we do, when I was at the University of Colorado, we developed a test against the immune system. You take the patient's blood and test it against the chemicals that are in the white fillings, the composites, the plastic fillings, and see which ones react with your immune system and which don't. And there's a very good reason for this, because a toxin, a bacteria, is a certain size, and the immune system produces antibodies, which are a certain size. Well, if you put the two of them together, they bond, and they make something twice the size of either one of them. You try to push that through the kidney, and you got little tiny tubules in there, and it gets hung up. Same with the brain, same with the heart. So you are creating little tiny dams in the circulatory system, which, if they're a little bigger, are called strokes. But this is not a real good idea. So you need to have the composite place that does not form these complexes. A complex is a term that describes where you've got the immune antibody and the toxin combined together. So the important thing is to select a composite that is not reactive with your specific immune system. and there are 70 or 80 different chemicals in the various composites. So you do these and find out there are, maybe 2,000 composites on the market.